Hello, everyone. Good evening. Hi, my name is Sarah Frazell, and I am the Director of Behavioral Health Programs at Primary Care Coalition, and I am a licensed clinical social worker in Maryland. I'm also the co-chair of the Social Workers Unraveling Racism Committee through the National Association of Social Workers Maryland chapter. And tying in with some of the things that we have seen already this evening, I wanted to talk a little bit about the impact of COVID-19 on helping professionals and, their mental health. So in looking at a survey from earlier this spring of over 26,000 public health workers, 53% of people reported symptoms of at least one mental health condition in the prior 2 weeks. Almost a third with symptoms of depression or anxiety, post-traumatic stress disorder, and over 8% with suicidal ideation. The people who were most impacted were individuals 29 and under, non-binary and transgender individuals of all ages, and people who were working long hours or had an inability to take off work. And so I know that was many of the folks who were on the front lines during this pandemic. So one of the things I think to keep in mind is that the stressors of normal life pre-pandemic didn't go away, but COVID added some specific new ones for everyone. Health concerns for ourselves and for our loved ones, financial changes due to maybe loss of work, loss of benefits, changes to routines and work schedules, changes to the way that we work. So maybe people were working longer shifts. Some people were working more from home or working more out in the field, feeling like they were kind of being put at risk, maybe without adequate PPE. Having a sense of the unknown, and I think that that's something that we continue to experience now, not knowing what will come next. A constant barrage of media. So I know I have felt that way, feeling like the first thing you need to do in the morning is check the news or feel like you're getting alerts on Twitter, on your phone, and not really getting a break. Compassion and concern for vulnerable communities. So, really seeing how people were impacted, and for people in helping professions, really kind of taking that home with them as well. And, a lot of us had developed ways to take care of ourselves, maybe going to religious services, going to the gym, seeing friends and family, and a lot of that changed. We weren't able to do it for a while, or it felt really risky. One of the other things that impacted people kind of on the front lines is moral injury and moral distress. So originally this is a term used to refer to soldiers. So it's when you kind of have to do something that either you weren't trained to do or that goes against your moral values. And that can quickly lead to shame, burnout, and impact your sense of right and wrong. So some of the COVID specific examples, in hospitals, when there weren't enough beds or ventilators, deciding which patients should get them. Maybe for those in social services, triaging which client would get assistance with rent and having to say no to someone else because there aren't enough funds. Creating policies while knowing that not everyone can get the help they need. And to kind of deal with moral injury and moral distress, it requires a system response to fix. So it's not any one person's responsibility. It takes kind of all of us together. So just a few of the signs and symptoms that have resulted in burnout for people on the front lines, and things to maybe watch out for in yourselves or in others. So physically, maybe a lot of GI problems, overeating, undereating, changes in appetite, headaches, backaches, lowered libido, also changes to your immune system. Cognitive, trouble focusing on things, maybe at work or maybe in leisure reading, having trouble reading more than a page. Having intrusive thoughts, so finding that you're thinking about COVID or thinking about things that you've seen at work. Trouble seeing any positives, feeling like everything is, very much death and destruction. And emotional changes. So a lot of people have noticed feeling more irritable than usual, feeling angry, feeling sad, feeling depressed. So this is a topic that really, you could talk about for days. There's a lot of content here. But I did want to talk about a few coping techniques that can be helpful. And I think the first really important one is to manage media input. I think a lot of people, we want to be informed about what's going on, but finding ways to set limits. So not checking your phone or checking the news first thing in the morning or late at night before you go to bed. Maybe setting a specific time in the day where you look at it for about half an hour and then moving on. Taking pauses throughout the day. It might even be helpful to set an alarm on your phone or on your calendar, reminding you to do some stretching, text a friend, do something you enjoy. Take care of your emotional and physical health. So make sure you're on top of your appointments, whether that's if you're in counseling or want to start doing that, getting your annual physical, annual screening, and not putting it off and not saying, you know, I'll postpone this. I need to help other people. You need to also be taking care of yourself as well. Practicing self-care in the workplace. So connecting with your coworkers, whether that's on Zoom or whether it's in person. Sharing responsibility with others. So finding ways to remember that you are not the one who's going to fix everything, and that it takes a community and it takes working with other people to fix these big problems that we're facing. And I would encourage you that if you are in leadership, that you create space for your staff to vent, encourage them to have self-care, taking lunch breaks, things like that can all go a really long way. I did also want to mention that what I was talking about before, some of those symptoms might be signs of stress or burnout. And a lot of those symptoms may overlap with depression and anxiety. So if you notice that those symptoms are continuing more than 2 weeks or they worsen, you might be experiencing depression and or anxiety and should contact a mental health professional or your primary care provider. So some signs of depression to be on the lookout for: trouble focusing, thoughts of death, self-harm, or suicide, sleeping too much or too little, eating too much or too little, persistent sadness, loss of interest in things you used to enjoy, and feelings of guilt, worthlessness, or hopelessness. And some common signs of anxiety are constant worry or trouble controlling your worries, irritability, a sense of impending doom. And often anxiety can have a lot of physical symptoms as well: a racing heart, rapid breathing, which of course you always want to check out to make sure there's not another physical cause, but that can be very common. And finally, I just wanted to close with some additional resources. Again, I encourage you to reach out to your primary care provider if you have one, or you may know somebody who's in counseling who can give you a referral. But if not, these are all resources you can connect. Again, I'll reiterate what was said earlier around the National Suicide Prevention Hotline. And then these are numbers available for DC and Maryland and Virginia if you're looking for assistance in connecting with a behavioral health provider. Thank you so much.